Hello, everybody. Welcome to another episode of SOMA Living. And today we're going to talk about the non-surgical boom. So what does that mean? That just means like all the injectables, the lasers, energy technologies, anything that's not actually surgery.
Yeah.
Okay, so what's our definition of surgery?
Right. I think anything surgical, I would say, is cutting the skin. Right?
Yeah, I agree.
So even liposuction,
Yeah, I mean, it's technically surgery.
we're still making a small cut in the skin and we're under the skin.
I think a lot of people call that minimally invasive.
Right.
Ish.
Yeah.
But that's a tiny little poke in the skin. We do have to do that for some non-invasive.
And it's still a small surgery. I mean, what is the definition of surgery can, vary, but I think it's a small surgery.
Yeah. So in general, surgery, I think everyone understands. It's when we make big incisions. Typically, there's sutures involved. Usually, that's the case. Yeah. So everything that's non-surgical or non-invasive are the things you go to a med spa to get, and that varies. So like if you go to a true med spa, you're going to get things that are really minor in general, like lasers that are relatively quick recoveries. You come to a doctor's office, and sometimes you'll get things that are still classified, but you may have like a week or two to recover. So sometimes these recoveries are as big as surgical recoveries, but we're not making incisions. So that's kind of at least my distinction.
Yeah, there's a whole kind of ladder of non-surgicals in terms of zero downtime non-surgicals, little downtime non-surgicals, and then, up to the whole, you may have some significant downtime, or this may be a little more involved, or you may need some type of anesthesia, whether that's injectable anesthesia or or topical anesthesia. So I always try to outline all of that for my patients because it can get confusing.
Yeah.
Yeah.
Yeah. So typically non-surgicals don't need general anesthesia, though you can get it if you really want to. But I would say 99% of the time you don't need it.
Yeah.
So, all right. So I guess what we really want to talk about is why have these procedures really blown up? Why have they become so popular?
Yeah. So I think it's a couple things. So one, no one really wants to have surgery. I mean, if you do, there's probably something wrong, or something missing. But in general, people are scared of surgery, right? Like I hear it all the time, and I'm sure you do too.
Yeah.
People are scared of anesthesia. People are scared of the recovery.
These are healthy fears. They're legitimate, real fears.
Yeah.
Yeah.
But in the end, we try to. I mean, millions of people go under anesthesia daily. It's probably one of the most studied, safest aspects of surgery or medicine that exist. So I try to, walk people off the ledge in terms of the anesthesia fear. But two, I think also, and tell me if I'm wrong, but almost all of our patients that end up going through with surgery are pleasantly surprised of how it really wasn't as bad as they thought it would be.
Yeah. No, the anesthesia, I think, experience is relatively minor for most people. I think the worst part is sometimes people have some nausea afterwards. It depends if you're sensitive to it. But the times I've had to have surgery, and again, I don't choose to have surgery. It's like if I really need it for one reason or another, or really want the outcome. But it's the anesthesia part is almost nothing. It's almost like a transparent portion of it. Like you go in, you wake up, it's done. It's like thank God I had anesthesia.
Right.
Yeah.
And I think the second part is people are wanting to get involved in aesthetic treatments earlier on. Younger aged people are looking for ways to improve their appearance and their skin health and all that stuff. And so that comes with not wanting to go under the knife when you're
it's also shorter,
30 years old.
Shorter recoveries too. A lot of them have very short recoveries or almost like instant outcomes. So that's part of it. Yeah. I think a big part of it also is just the technologies have gotten so much better. When it first started, we had a few things we could do that could make a difference. Sometimes the recoveries were pretty significant, like old school CO2 laser, you know. And then fillers sort of came onto the market, and freezers like Botox and those types of things. And those were nice because there were like no downtime really, or almost none. But now we have all these energy technologies that can actually do something. It used to be you couldn't get your skin to tighten up really without cutting some off and pulling it. But now
Yeah,
now we can.
people want that instant gratification treatment. They want to look red carpet ready the next day with no downtime. I mean, that's the most common thing. You know, we have to turn down patients for certain treatments all the time because people are like, oh, I have this event tomorrow, so I wanted to come in a day before and do some treatment. And we're like, okay, let's pump the brakes here.
Right.
This is not how that works. I mean, we always say in general, if we're putting a needle into your face, you could almost expect bruising. You're going to expect some potential swelling. And that's just the reality of, again, kind of breaking the skin with a needle.
Yeah, there are very few non-invasive techniques that have zero risk, meaning like no risk of bruising or anything. Now, there are a couple. There are a couple. We'll talk about those. I think those are kind of fun. Those are some of the new technologies.
Yeah.
All right, so what else? We talked about the pros and the cons. We talked about why we think they're exploding. Let's talk about some of the most common misconceptions. So, I mean, like you said, a lot of patients think that they're going to get an instant result with no risk whatsoever, and they want to look good for the next day. What do you tell patients in general when they have that expectation?
Yeah.
Because some of them are willing to take some risk.
Right. I think that depending on the treatment, I think there's, like I said, in terms of if there's a needle, I tell them that there's 100% a chance that, 100% a chance. I tell them that there's a high chance that they could get a small bruise. I don't think bruising is super common with something like neurotoxin, like Botox or Daxxify.
It's a tiny needle.
Yeah. So in general, I think bruising is rare with neurotoxin. But then the problem with neurotoxin is it takes days to see the effect.
Right.
So if you're trying to get a next day change, that's tough. I mean, for filler, I tell my patients,
can do it.
Yeah. For filler, I tell my patients like, you know, a week or so to really see the final result because you're going to have some swelling that needs to subside. You know, all that.
And you could get a bruise.
Yeah.
So
With filler, I almost say you're going to bruise.
So there are some techniques that we have that make it a little bit lower risk. Like if you put like immediate pressure on and hold it on for a while. And it's honestly, a lot of people don't do that because they're kind of in a rush. They go into the next area. Sometimes I'll even have my patients help me. I'm like, hold that there while I work on the other side.
Yeah.
The time I think I feel more comfortable with patients like that who are asking for immediate change for something like the next day are the regulars.
Yeah.
Those who've had fillers many times, been doing it for years, they tend not to bruise and they swell minimally. I think their bodies have just gotten used to it.
Yeah. And I think that, if you're like a frequent flyer and you kind of know your body, and also there are parts on individual faces that will always bruise, right? Yeah. So a lot of times I have a patient come in and be like, this spot right here, I always get a bruise. So try to navigate around that. And that actually is helpful. So to tell your provider, oh, this eye tends to bruise in this spot, there's actual science behind that because there's probably a vessel there that gets hit with a needle. And if you can tell us to slightly avoid certain areas or show us where you may bruise, then we can kind of
work around it
and navigate.
You can also sometimes look for the little veins and avoid them.
And that can be helpful, and that can you know expedite your downtime and minimize.
Not a guarantee.
Not a guarantee. None of it's a guarantee.
All right. So some people think that they can get the same results though from non-invasives as they can from surgery.
Yeah. That's probably one of the hardest things that we have to counsel our patients is where to draw the line. What is your goal? What is your expectation? How much of an improvement are you looking for? And that's when we kind of go through that whole conversation. So what are some things that you...
Well, I mean, people come in all the time like, I want this to be improved, but I don't want any surgery. Yeah. I'm like, well, all right, if you don't want surgery, you really don't want surgery, I can get 10%, 20% improvement, whatever, depending on what it is they're trying to achieve. A lot of the times it's because of the signs of aging or skin laxity. Cases like that, I mean, surgery really is the best. That's the best. That's the gold standard. Yeah. So frequently I will tell them, look, if you really want that result, you're either going to not get it, have to be okay with it, or you're going to have to commit to doing actual surgery. Yeah. I think that one of the interesting things that we do on a regular basis is lowering people's expectations. Yeah. So whatever it is, the vast majority of people come in wanting, to look like they're 20 when they come in and they're 60. So we basically have to bring them back down to earth and
Yes.
say, all right, we're
All the
not
time.
magicians,
Yeah.
we're surgeons, right? So, but we can make some nice changes,
Yeah.
some really significant ones. But it's not we don't have the technology yet.
Yeah.
And I say yet because one day maybe
Yeah.
we will.
And so much of it, again, goes back to, oh, well, I don't want the downtime. I don't want the anesthesia. What can we do to hold me over? There's a lot of that talk, right?
Yeah.
And it's interesting. I've spoken to other surgeons about this too. And practices are starting to make patients consent, like a specific consent, saying that my surgeon recommends this, which is usually surgery.
Right.
However, I am choosing to go against the recommendation for a less downtime, non-surgical option that may or may not make a difference, and I may still need his original recommendation surgery down the road. So people are actually kind of creating these kind of custom consents for these non-surgical things because it's the hardest part for us is that we can't guarantee, everyone reacts differently.
Yep.
And so,
Even from surgery. Surgery is a little more guaranteed, but even that.
Right.
So it's, but you're right. I mean, and then people also forget. They forget the conversation we had.
Yeah.
They forget. They're like, well, wait, you said I could get this result. I'm like, no, actually, I said if we did surgery, you get that result. So anyway.
Yeah.
I think patients also often feel like they can get a lot of these things just done at home. There's all these products being sold directly to consumers now.
Yeah.
Like this home-held laser, this home-held microneedling, or whatever it is.
Yeah.
My experience is those things don't do a lot.
Yeah.
Now, not to say that they have no value. I think a lot of these things have some value. But if you really want a real treatment, you want like a real result, you're going to have to come in to the doctor's office or at least a med spa, and get some of these real technologies.
Yeah.
And they're not ones you're going to get at home. First of all, you can't buy them unless you have a medical license. And even if you can find one on eBay, they're still going to be very expensive. And trust me, you don't want to buy something on eBay if you don't know what the hell you're doing.
Yeah.
Or you don't even know if it works.
There is this kind of fad, or I don't know, whatever you want to call it, that people are trying to get like gray or black market injectables and are actually trying to inject themselves at home.
Yeah, that's scary.
It's scary. And it's becoming a thing. And because people, there's this whole boom in kind of this direct to consumer idea, even like you said, at home microneedling, at home, all these at home treatments, which are not going to be anywhere close to true medical grade office treatments.
And they shouldn't be.
Right.
Because that's scary. It's dangerous.
Yeah.
You need someone who knows what they're doing so you can mitigate that risk and pick what's best for each patient.
Yeah.
I'm sorry, you were saying?
And so it's just, the reality is like it's unsafe. You shouldn't do it. If you're interested in those treatments, you should be getting those at a doctor's office or at a, accredited med spa. And I mean, it can open up a whole can of worms in terms of complications and risk.
Oh, I've seen some horror stories.
Yeah.
So one thing that's been around for a long time and people are still doing is injecting liquid silicone.
Yeah.
Liquid silicone is a very risky thing. Now, most people who get it love it right away because it looks great immediately. And it can look good sometimes for years. And in many cases, you don't have big problems with it and people are fine with it for their whole lives. But of course, we see all the horror stories.
Yeah.
We see people with all kinds of reactions to it. It migrates, it causes fibrosis, causes all these changes in the skin, causes granulomas. We end up having to cut it out. I've cut it out of people's faces, out of their butts, out of their ankles, because it was supposed to be in the butt and went all the way down to the ankle. Avoid it. If you go to a legitimate med spa or especially a legitimate doctor's office, it's exceptionally unlikely they'll recommend using it, especially in large volumes.
Yeah.
Yeah, I know some people still use small volumes for fix little dents on the nose and stuff, which honestly I don't recommend either because I think they're better products.
Right.
But I think the risk of that is small.
Yeah. Yeah. I mean, there are permanent products that are, well studied and, that we do use that can give a good result. But in general, I try to kind of err on the side of using dissolvable or reversible products.
Yeah.
And, so
absolutely.
So what are some at-home things that you can do there that we think are decent options?
Yeah. Well, I mean, other than the obvious things like skincare, we can get to that later. But like some of these technologies, some of these low energy red light therapies, actually I think are probably pretty good.
Yeah.
So the risk of red light therapy is very small. There are better products and there are less good products, but I think even the ones that are don't have data behind them aren't going to injure you.
Right.
So I think that's fine.
Yeah.
I think some of the needle rollers, I think the risk is small as long as you follow directions and are clean.
Yeah.
You know,
You're not overdoing it.
not overdoing it. You're like literally make sure your skin is clean before and after, so you're not like introducing bacteria into your skin.
Sure.
You know, I think those are okay.
And there's so many little nuances though that people don't think about when they're doing it at home. They they might not even think to wipe off their makeup or something for the day, and then they'll start needling their face.
Right.
It's these little things that don't come intuitively to the layperson. There's nothing wrong with that.
Yeah.
But that's also why you see a medical professional to do these things.
Yeah,
And
makeup's not supposed to be in your skin.
right.
It's on, not
Right.
in.
And that can cause a whole host of issues.
Yeah.
Yeah.
Those galvanic skin, the stimulator things, I mean, those are supposed to like improve collagen or muscle tone. I think there's no risk. I mean, those are fine, I think.
Like even those collagen masks.
Yep.
Yeah, you can get some hydration, like all like the Korean beauty kind of glass skin masks.
Yeah.
They're going to do something. It's not and then the most common thing we get asked too is how long is this going to last? Right. So yeah, you'll see definitely some overnight improvement, hydration in the skin. Your skin's going to look more taut. It's going to look, those lines are going to be a little bit smooth because of that temporary hydrating effect. Are you going to get a long-term improvement in your wrinkles? Probably not. If you're doing this on the regular, yeah, you might see some improvement, but marginal.
Those at-home like microdermabrasion things, they probably work, but you have to be careful because again, overdoing those can cause major problems.
I've probably overdone things like that, because you want to, I know how much I could do on my face too in terms of what I do on patients, and sometimes I've definitely over exfoliated, so that can be. You end up with almost like a scab on your face from over exfoliating.
You can injure yourself.
Yeah.
And, I think most people have this mentality, if a little is good, more is better.
I know.
And, obviously we all know that's not true, but we still have a hard time stopping ourselves.
Yeah,
So,
I know. I'm definitely like a more is more person.
Yeah.
Which is not always a good thing.
Good, yeah.
Yeah.
So I think that kind of covers most of the things I can think of that are home-based.
Yeah. I think when it comes down to it, you want to do your research on the company. Can you get a red light mask off Temu that's going to do something? Probably. Yeah. But if you want to invest in something that's maybe actually going to change the quality of your skin and have some medical backing and have some science and research behind it, do your own research and see if that company actually has some data behind their devices.
And sometimes the med spas or the doctor's offices will sell some stuff to take home. And I can't speak for every med spa out there, but I think most of the doctor's offices, most med spas are going to carry products that have some real efficacy.
Yeah.
They're not going to just carry some garbage thing that they bought off of Temu.
And use your resources, use ChatGPT to look into these products too. Ask ChatGPT if there's research behind this product. See what the actual scientific benefits are and the medical benefits, and you can probably get a good amount of information just from that.
Yeah,
to verify.
ChatGPT is kind of amazing.
I know, we use it.
Yeah. So I think another misconception is that people feel that if it didn't hurt, then it wasn't effective. Now, I think that's true. Actually, a lot of the time,
it can be.
Yeah,
the no pain, no gain.
Right.
Yeah.
So I think a lot of the time you do have to have some pain, but that is changing.
Yeah. There are a lot of new technologies that are using other technologies to mitigate that pain and dampen that pain using things like cooling or things like pulsing. Right. What have you seen with that?
Well, I mean, the one that I think we've been using a lot in the office lately that we're all excited about is, and this is not a promo for any brand, by the way, but we're just talking about
We're not sponsored
yet.
No.
Yeah. But this particular brand, this particular product we really like. It's called Zerf. And I tell everybody it's like Nerf football, but with an XX, the XERF. So it's a dual frequency, radio frequency device, no needles, it's just superficial. Which has cooling cycles built into it. So the theory is that it heats your collagen without heating the fat because there's no bulk heating because it cools in between. But the heating of the collagen is enough. It stimulates the collagen to remodel, to tighten without killing fat.
Yeah.
And without pain. So that part, I've had it done. I did it once myself. I know you've had it. And I know we've been using it a lot.
Yeah.
And the immediate before and afters on this is quite
Crazy.
Yeah. So it'll be interesting to see what kind of long-term benefits there are.
And people, patients are asking, oh, it's really not bad. Am I really going to see? I mean, the answer is we're still waiting to see, but for the most part, our patients are loving it. They're loving the immediate. I've had patients message me after. They're saying that they have like a glow. They look great. So it's doing something. And that's a good example of not the most painful treatment, but a pretty robust result.
Seems to be quite effective. And there are long-term studies, not ours personally. We've only had it for about a month.
Yeah.
But there are long-term studies out there that do show long-term results.
Yeah.
So I believe that it will make a difference for the vast majority of people.
Yeah. So the pain aspect of these treatments is almost becoming, a little out of fashion in the sense that now that a product isn't going to do well if it's super painful. And we've seen that. We've seen products come and go, devices come and go because of the significant pain that patients have to endure.
There was this one device we had years ago. It was a radiofrequency device, similar, and it was highly effective, but it was so painful that nobody could do the treatments.
Right.
After one treatment, they're like, I'm done. I'm never coming back.
Yeah.
But every once in a while, you get someone who just had an incredible tolerance, and they had results like I couldn't believe.
Yeah.
So these technologies do work. It's just that how do you figure out a way to actually deliver the energy in a way that patients can tolerate without putting them under anesthesia?
And find a patient that's willing to accept.
Yeah. So, but that's another thing about I wanted to touch on. As far as these energy technologies go, it's not a one-size-fits-all, and it's not a guarantee because our physiologies between individuals differ.
Yeah, so talk about that. What have you seen over the years in terms of that variation?
So I've seen a lot. I mean, part of it is ethnic, meaning certain ethnicities tend to respond a certain way, but it's not necessarily a guarantee. Like there's variation even within certain ethnic groups. But I think the biggest thing, at least we can talk, I think the best way to do this is to talk about each energy technology.
Yeah.
So each energy technology has kind of a different set of parameters as to how you respond. So we already talked about RF, so let's talk about RF. RF is radio frequency. Basically, it's electricity. It's certain frequencies of electricity. It excites your tissues in certain ways. It tends to be attracted to water and collagen, not so much fat. Fat's more like an insulator. But the idea is it heats tissue. And it can selectively heat tissue based on the frequency and various things like that. So it's what I've seen about it, though, is some people just respond better.
Yeah.
Meaning their collagen tightens and remodels and they get really good results. And other people see very little results, very little improvement. And also some people's fat is more sensitive.
Yes.
Whether it's to the RF or to the heat, I'm not entirely sure. Probably the heat. And some people will lose more fat, and some people, no matter what you do, you can't kill their fat. Their fat's super resilient.
Yeah.
That's a little bit based, in my opinion, a little bit based on age. Younger people tend to be more responsive, and their fat is more resilient. Older people less so, and that makes sense. Just as we get older, our physiology, everything slows down, less reactive. I found certain ethnicities tend to do better.
Which?
Okay. So I find Asians tend to respond very well. I find to the heat, to the collagen. I find Caucasians tend to do really well, especially for the tightening aspect.
Yeah.
I find people of Middle Eastern descent, for whatever reason, seem not to respond as well. They don't get as much tightening, and sometimes they lose fat more excessively. I don't know why that is, but I have seen that to be the case.
Yeah. I think I try to tell my patients, certainly age, it's one of those things where if you're, past the point of where your body is really on the decline in terms of new collagen and elastin, which is the contractile components of our skin, you're just not going to get as robust of a response. Another thing that probably both of our largest patient population is women between 45 and 55. So you're looking at perimenopausal, if not menopausal. So menopause is a phase where you're going to start losing your skin elasticity as well with the hormonal changes.
It's true.
So that is like a big topic of, my counseling and consenting for these different things. And I say, if you are in that perimenopausal phase, you're probably not going to see as robust of a tightening response as maybe if you had before. So, and that's something that can be hard because maybe they did get a good result years ago, or if they had been, oh, I did this treatment 5 years ago, why is it not the same? Well, your body's not the same, you know?
And the truth is, like the hormone replacement therapies and stuff, it does make a difference.
Yeah.
It can help.
Oh yeah.
Now, not everybody is a candidate
I
for
know.
that.
Yeah.
So,
It's
you know,
tough.
yeah. But if you are, I think there is definitely some value for it.
Yeah, and I do always look for that on, you know, my patients when I review my patients' medications, and I do like to see hormone replacement therapy in my patients because then I know that they're, you know, rejuvenating on the inside too, and that can help a non-surgical external treatment.
Yeah. So I wanted to also mention some of the other technologies. So lasers, of course, everyone knows what a laser is, and sometimes they call everything a laser, right?
Yeah.
Which isn't the case. Yeah. But so a laser, very specifically, coherent light, all the exact one wavelength of light. They're all like lined up. So that's the technical aspect. But so lasers, I mean, it is light, not radio frequency, not electricity, not electrons, and it can heat tissues. So it can do other things to tissues too. But for the most part, it's exciting the molecules based on absorption and causing heat and injury. So there's lasers is a whole topic. I mean, we can go into the whole thing. We can have like a multiple lecture series on lasers if you really wanted to. But in general, the lasers are tuned to target certain chromophores, meaning certain things that absorb certain wavelengths. Yep. So the ones that we use for resurfacing a lot are target water. Yep. So that's like CO2, erbium lasers, things like that. Right. And that just basically generally heats water. So there's water in your skin. It heats that in general, so it kind of heats anything that has water in it. And it can either ablate the tissue or not ablate. Ablate meaning just basically vaporize, like burn it up. Or it can injure the tissue but not completely vaporize it. And there's nuances to all that. The take home is some people are good candidates again, and some people aren't. It's probably better for fine lines and wrinkles and things like that. It's also good for like the texture and the color of your skin. So it can give you that sort of baby skin look. Yeah. But it does cause some heat superficially. It can predispose you to some darkening of the skin, hyperpigmentation, if you're of certain ethnicities. So Asians, increased risk. Even if you're fair skin, slightly increased risk. Anyone with a little bit darker skin, which includes the Hispanic and Middle Eastern descent, African descent particularly so because you're extra dark. We avoid lasers in most people with extra dark skin. But there are some lasers that you can still use. Yeah. So, but lasers I think are great for like that skin crepe. Yeah. Now, of course, ethnically speaking, who gets the skin crepe more? Caucasians. Right. So it's kind of perfect for Caucasians.
Yeah, and I've also seen the other end of the spectrum too, where extremely fair people can also have a somewhat negative reaction in terms of that erythema too.
Oh, red. Yeah,
right. Yeah. It's that if you almost have like that pink, really pale pink tone, then you also may be at some predisposition to hyperpigment or get what we call post-inflammatory hyperpigmentation or erythema. Well,
yeah, it's almost like a hyperemia though. It's
right.
So in patients who are really fair, rarely do they get the pigment, in my opinion. They get red. So it's increased blood flow. Yep. So all your little capillaries dilate as part of the healing process, but some people can have prolonged redness. Yeah. I remember back in the day, I did a CO2 laser on this one patient, and I'm like, yeah, you can have up to 6 weeks of redness. 6 months later.
Oh my gosh, I know. Yeah, it can happen.
It can happen. Luckily, the redness usually is self-limited. It will eventually go away, even if you're one of these like 6-month people. Yeah. And hers did. Yeah. It finally went away.
And then the other kind of target for a lot of these lasers, besides water being the, erbium and CO2 being the main lasers that target water, is lasers that target melanin or the pigment in our skin. So those are different wavelengths for that different chromophore. And then there are also other lasers that work not so much, they are drawn to that pigment, but they don't work so much by heat, but they work by what they call like photoacoustic or mechanical energy, and things like picosecond lasers, which shatter that pigment or those molecules of pigment in the skin and kind of help clear that through a mechanism that's not thermal or not energy related. Right.
Well, and then, I mean, technically still energy.
So
the way I think of it is, the way it was explained to me is, it's relatively high energy, but it's such a quick
Pulse,
burst
yeah,
that it
burst.
doesn't have time to produce heat.
Yeah.
It literally just explodes it. It's like
Right.
it just zap, and anything that absorbs it just explodes.
Right.
So because of that, you get less heat injury, and the heat is the thing that tends to cause pigmentation.
Yeah. So lasers like that actually can be safe on even black skin, or what we call Fitzpatrick 6 skin. So, you know, you have to, again, you got to do your research. You got to, you know, learn what the laser is actually doing, because it's a huge body of information. It can be really overwhelming for the patient. And, but you know, you got to ask these questions. What is this laser targeting? Is this safe on my skin type? And you know, if you do have Asian in your skin, then you should be graded on the higher skin type for your own safety and to help with that inflammation and that redness or pigmentation after. So there's a lot of things to think about, and that's why it's important to go to someone that knows what they're doing.
Yeah, and knowing what you're doing isn't just someone who's smart, though obviously that helps, but with experience.
Yeah.
And a lot of this stuff comes because you buy a laser, the companies know some of it, like how do you use it and who should you use it on, but so much of it comes just from our personal experience, because we know as the providers, we ultimately know way more than the companies that actually make the lasers.
Right.
Because we're the ones who use it on people. We know the exceptions and the people you'll get a good result and when there might be a risk.
Yeah.
And on top of that, we also know how to treat, hopefully, how to treat the complications.
Yeah. That's huge.
Yeah. And the complications happen.
Yeah. So, and we actually studied this stuff, you know, like no one just put this device in our hand and was like, here you go. We've studied the science behind these devices. And that's, you know, I saw this girl's Instagram post the other day where she was like, I've had so many, let's just give it, you know, I've had so many PicoSure Pro treatments and they've all been different. And here's why. Yeah. It's not because the device is different. It's the same device. It really is because the provider is different, and there's different levels of expertise among those providers. And one thing that kind of really resonated with me is that when I treat my patients, I'm always explaining to them, even if they might not understand what I'm saying, I like to at least explain my changes in settings, why I'm changing the settings, what I'm doing for your unique skin to give you the best result based on my experience, based on my knowledge and our training, which is extensive, to give you a great result. And that's why it might be the same device at a different office, but you're not getting the same treatment.
Typically, when MDs or when advanced nurses are doing it, typically you'll get a better result because, one, they have more experience. Two, they know how far they can push the envelope. And three, they're more confident on how to manage a complication if they get one.
Yeah.
So when you go to like a med spa, a lot of the people who may not have that much experience, they're going to be very conservative, and they should be, because if they get a complication, they have no idea how to manage it. Yeah. So we will sometimes see those patients, like they come from those places, like, oh no, we got this happened to us. What do we do? Yeah. And they'll send them to us to deal with.
Yeah, absolutely. So I think one other thing too, which will be, you know, interesting to talk about, is skincare in general is huge, huge billion-dollar market across the world. And
I know you like skincare. You use it yourself.
I do, and I think I think if you're trying to seek that anti-aging aspect of things for your skin, I think it's important. One thing that I'll never forget and has been a huge part of my skincare because of residency is one of our attendings, or one of the surgeons that we worked under in residency, he was older, but his skin was amazing. He always looked amazing. And he would tell us early on in residency that he was on a really high dose of tretinoin. So tretinoin is a retinaldehyde, or a type of vitamin A. And so the cool thing about tretinoin, and it's kind of this, not many people know this, but it's probably one of the best studied, most evidence-based topical skincare treatments that have actually been shown to reverse sun damage and aging in the skin long term. So even like over-the-counter retinols that you get at, you know, CVS or Target or Sephora or Ulta, they're going to have some improvement and some reversal of those fine lines, wrinkles, sun damage. But prescription strength tretinoin is going to really have a long-term reversal. So it kind of is I think it is truly the only truly evidence-based topical that's going to reverse damage.
And vitamin C too.
Yeah.
Right.
Yeah.
There's some evidence with vitamin C for it reverses some DNA damage.
Some, yep.
Yeah.
Yeah. So I've been on like a pretty high dose, like 0.1% tretinoin, since I was a resident.
Wow, that is
and I think one, it helped me. I was always acne prone a little bit. So one, it helped with my acne a lot. Two, I think it's just made a huge difference in my skin overall. So, you know, if my patients are interested in things like that, I'll try to, you know, see if it's appropriate for them. You know, it's not a blanket treatment. It can take time to adjust.
Yeah.
Can make you pretty dry. You can have a little bit of a purge initially. We usually start patients pretty low in terms of concentration and work your way up. But I think it's kind of one of those, one of my like holy grail, you know, regimens.
I mean, that one's tried and true.
Yeah.
And that's like one of the things that we know is truly effective.
Yeah.
And of course I don't do it because I'm horrible when it comes to my skin. Yeah. All right. So, I mean, you're great about the whole skincare thing already.
I try.
I'm terrible. I think I'm old school. I'm a little older than you. And so my generation, men didn't use skincare.
Yeah.
And I think it just never became a habit.
Right.
So it's, and I should,
Yeah.
but I'm just terrible at it.
The
I rarely even use SPF, which is really bad. I just avoid the sun. I mean, but
I know.
Yeah, but it's I did actually start a true facial cleanser. I used to just use soap on my face.
Yeah.
But I started using a facial cleanser a number of years ago because one of the reps I complained, "Oh, I have oily skin." It's like, and I said I use soap. It's like that's probably why you're over drying your skin.
Right.
So I started using an actual facial cleanser and like a mild one.
Yeah.
And it actually made a big difference.
Yeah.
My skin's less oily than it used to be.
Yeah.
So, I mean, that's it. I really should do more. I tell my patients to do more, but I'm not doing it myself.
And it all comes down to just getting into a routine. And it can take time, you know, it can take, 20 minutes sometimes before bed or whatever, even in the morning. But I mean, I think another thing that you mentioned, which is part of my morning daily routine, is vitamin C. I think vitamin C is probably one of the best things that you can put on your skin after you cleanse in the morning, after waking up, just to give you kind of like that brightness and glow throughout the day. I think a solid, highly concentrated medical grade vitamin C I think everyone should be on a morning vitamin C.
Yeah, and there's good studies that show that topical vitamin C is more effective for your skin than taking it orally.
Yeah.
So putting high dose topical vitamin C, not so high dose that it burns your skin, because it can, but high dose vitamin C can actually reverse some of the DNA damage from sun damage. There's studies that show that, which is quite interesting.
Yeah. So I think that's a one that I really kind of try to get my patients on, or get them in their routine for. I think it makes a difference. And of course, I mean, we'd be remiss if we didn't say SPF.
Yes. I do use it. When I know I'm going to be in the sun, I'll spray myself, but I don't use it every day. I'm usually inside every day. I mean,
even though you should. I mean, it's if you can get on a good daily SPF that doesn't look like you're wearing anything. You know, we carry some here in the office that are SPF 50 that are kind of a daily wear type thing. It's great, and it's only going to make you look better long term. And
and if you can use it daily, you probably should use a physical blocker, not with those chemical blockers.
Yeah.
The chemical blockers, there are studies that it absorbs into your skin, and so that you can actually measure it in your bloodstream. We don't know if it actually does anything because it's never been linked to anything. But still, it's just a foreign thing in your system. Prefer not to have it if you can help it.
So we definitely prefer physical mineral sunscreens over the chemical ones in general.
Okay.
So what are you doing then? I mean, I know in general you have all this stuff and you barely do any of it, but what are some of your favorites?
Oh gosh. I mean, honestly, I think just the facial cleanser. I really don't do anything else.
Yeah.
I've started using stuff for hair because my hair's getting a little thinner. So I'm using like topical Rogaine and finasteride. I just started that.
Yeah.
I'm terrible. Truly.
But you do hyperbaric once in a while. So device wise.
Okay, so So I mean, if you're talking about skincare, if you're talking about not just skincare, okay, fine.
So not much skincare.
So if it's not just skincare, yes, I do hyperbaric oxygen therapy every once in a while. Great, I love that. It makes me energizes me.
Yeah.
I'll do I have some peptides that I do, which I think help with just maintaining lean muscle mass, that kind of stuff. I am on TRT, so just being 55, it starts to reduce. but very low dose.
Yeah.
I do, let's see, occasionally I'll do like a vitamin drip or something like that. Let's see, what else do I do? I mean, exercise. So that's just normal daily stuff with like good diet and exercise. That makes a big difference.
How are you with are you a good sleeper?
Usually, yes. But it's, as I've aged, I don't sleep as well as I used to. I tend to be a little more restless sometimes. I wake up more. But I've never been a terrible sleeper. I used to be an amazing sleeper. When I was a teenager, I could sleep it's like, go to sleep. Okay. Within 30 seconds, I'd be asleep. No matter where I was, I could do it.
Yeah.
Not so much anymore.
Right. I know. Even in residency, I just remember I was such a good napper because you had to, I mean, even if it was 30 minutes that you'd have to just close your eyes, I'd like be out. Yeah. You know, but no, so one thing that I've told you about that I've really liked is I'm a hot sleeper. So I would get hot just from, if it wasn't 65 degrees with the AC wasn't blasting. So especially in California, like it really gets down to, being pretty cool out to have to open. Now we can finally open the windows. But my mattress actually is temperature controlled.
I know, I got to get one of those.
So it's it's called 8 Sleep, and it uses water. So it literally has a water tank next to the bed. It's controlled through an app, and based on the phase of your sleep, it can adjust the temperature of the mattress so that you don't have to blast your AC. And so you can it's almost like being on like the cool side of the pillow, right? But it's your whole mattress. And so that's helped my sleep a ton, where I don't wake up kind of sweaty and just sleep better because I'm at a cooler temperature.
I got to get one of those. I do have this one that blows air. Kind of like the bear hugger, but you can adjust it high and low. And that one, it was okay, but I have to admit, it's a little weird feeling like air
a breeze,
like moving.
Right?
It's a little weird. So I don't love it, but I do like it. So, that's as I've aged also, these are things you'd notice when you age. I'm sure other people out there have noticed these things too. I'm slightly less of a hot sleeper than I used to be. Slightly.
I probably am too.
Yeah.
I used to be really, but I think it might be the mattress though too. So who knows? One thing that I don't think either of us really do that much of the treatments here as we should. We did the ultra clear laser on you, which was an erbium laser. And I actually haven't even done it.
I got a little pigmentation from it. It went away, but for a couple months I had a little pigmentation.
But you also were non-compliant and didn't wear sunscreen.
That's true.
So I mean,
doctors are usually the worst patients. Just as a general rule of thumb, every time I have a doctor come in, I'm like, you're either going to listen to me and you're actually going to be great because you actually pay attention and listen, or you're going to be the worst. And usually they're the worst.
I haven't tried. I really haven't done I've done the Halo in the past. Sciton. I haven't done the ultra clear yet. I really like microneedling. I think it's a good way to make a really beautiful improvement in the skin with pretty minimal, if no downtime. If I microneedle myself, I look fine the next day.
You mean without RF, right?
Just cold microneedling, or like we have Skin Pen or one of the other devices.
And that's one thing we didn't actually talk about is microneedling with like some of these.
I think it's the boosters.
Type things. Yes. So the boosters are things that we really should at least talk about for a second. So things like PDRN, PDGF, exosomes, stem cells, PRP, PRF. So PRF, I think, has gotten a little bit of play on the social media lately, right?
So Haley Bieber was on a podcast and she was asked kind of what some of her favorites are, and she mentioned Easy Gel, which is a product that we carry. It's basically a system where you make PRF, so platelet-rich fibrin. We draw your blood, we spin it down, we get the platelet-rich plasma from that, and then with a series of reactions, you can make a thicker product.
It kind of activates it and it gels up. So it actually becomes thick, so it stays where you put it. It can bulk a little bit, kind of like a filler. I think the most important thing is it stays where you put it. Because when you inject just regular PRP, it's very thin and it'll dissipate relatively quickly. One thing I found that PRF works really well for are like the little teeny fine lines, like the filler under the eye stuff. So you can get improvement with the under eye without the risk of getting that sort of the Tyndall effect, the blue from some of the HAs, without overdoing it. Because sometimes you put it in, it looks good, and then it draws water and gets puffy. It doesn't happen with PRF.
So the one thing that I would say about both PRP and PRF is these treatments do take, a few sessions.
Yeah.
You're not going to see a huge change with one treatment.
Right.
So I usually tell my patients at least 2 or 3. And if you're the type of person where you like maintenance, if you like a routine, then it can be a really great treatment. But you're not gonna see a robust change with one.
Yeah. Well, I have seen some incredible changes with things like PDGF.
Yeah.
So PDGF is platelet-derived growth factor. It's one of the main growth factors that's in PRP and PRF, but now it's recombinantly produced, meaning they get bacteria to grow it like a farm. So it's
crazy.
Pure. So it's and that's really neat. I've seen some incredible reactive responses from that, where it thickens the tissues and everything.
And what's nice about that, like you said, it's just an off-the-shelf product, basically, that you know what you're getting. I always tell my patients, in terms of PRP and PRF, your own PRP and PRF, it's only as good as your protoplasm, right? Yeah. So if you're unhealthy or live an unhealthy lifestyle, if you eat bad, if you're older, the reality is that your plasma from your blood is not going to be as robust and have as many growth factors like PDGF and like stem cells and all these other things that a younger, healthy person may have. So what's amazing about these off-the-shelf boosters is that it's more of a guarantee. So rather than taking the chance of, was I, unhealthy this weekend, maybe I shouldn't do my own PRP or PRF, maybe I'll do an off-the-shelf product. And I think people are seeing such a great result with those because it's a little more of a guarantee.
So I'm going to bring up something that's super controversial, but I know there's some good evidence behind it, is young person's plasma transfusions. Yeah. So it's so I know there was a company that started a while back up in the SF area. I don't know if they're still in existence. I know they ran into some trouble with the FDA, but I think it's just because it was a controversial thing. Yeah. Medically, legally speaking, I actually don't see a problem with it.
I mean, people donate blood and get blood transfusions all the time.
So and there's all these rumors that so and so like Mick Jagger or who knows. Mick, if you're watching this, I have no idea if you're doing it. But and if you are, it's working fantastic. But it's like people are getting transfusions to stay younger.
Yeah.
There was I read this study that was done a number of years ago with rats. So they took so these are genetically identical rats. They took an elderly rat and a juvenile rat, and they sewed their bloodstreams together. So they shared one bloodstream. The old rat reverse aged. Yeah. I mean, it's crazy.
Yeah. I know.
This is stuff, I mean, we need to have a one podcast just about super controversial, crazy stuff.
That's true.
Yeah, I think we will do.
A lot of disclaimers, but...
Yeah. Well, I think we're going to do that one. I think that would be really fun.
All right.
So any case.
Yeah.
So I think we should probably start wrapping this one up.
I mean, we could go on and on. I mean, the whole non-surgical market it's amazing, and it's only getting better. I think it's getting smarter. I think providers are getting smarter, and we're able to offer our patients some pretty amazing things that make real changes in your skin.
Yeah. And just in terms of the things to do on a daily basis that make a difference, regardless of whether or not you come into an office like ours.
Yeah.
Things like, SPF, obviously, protect your skin, retinols and retin-A in particular, antioxidants in general, orally and on your skin. And just, health, basic, being in good health, good diet, exercise, all the things we already know we're supposed to be doing.
Yeah.
We just have to do them.
Yeah. But come see us. I mean, we could come up with a whole plan for you too.
Yeah.
It's fun, and it's cool to kind of create the best version of yourself, and with all these different little tools.
Yeah. It's a project. I like a project.
He loves a project.
All right. Well, thank you, everybody. Thanks for watching another episode of SOMA Living, and tune in again. We'll have another one every week.
Thanks, guys.